The hydrocarbon pollution remediation project Hyprep, led by the project coordinator, Professor Barini Zabi, has received the Technical Planning Committee on the operationalization of the Ogoni Specialist Hospital at the Project Coordination Office in Port Harcourt, River State. The committee, led by Professor Christy Malo, is made up of seasoned and experienced health professionals drawn from within and outside Ogoni land. They were in Port Harcourt to submit the well-developed report and comprehensive framework aimed at ensuring the smooth and sustainable operation of the hospital upon completion. Presenting the report, Professor Christy Malo explained the consequences of years of oil exploration and its resultant effect on Ogoni land and Ogoni people vis-a-vis the establishment of the Ogoni Specialist Hospital by Hyprep, following their terms of reference to develop a comprehensive master plan for the smooth running of the facility.
Ogoni land, like we know, has been exposed to prolonged oil contamination that has polluted water sources, soil, and air. The consequences have caused a complex mix of direct environmental poisoning and socio-economic issues. Consequences of this oil pollution in Ogoni land include limited income for the people of Ogoni, limited livelihood options. Farmers and fishermen with less pollution are unable to access their means of livelihood. There's food insecurity for a people that are known to be very good farmers. The largest yams around usually come from Ogoni land, but that is no longer so. So there's food insecurity and there's very poor access to health care. This situation has increased calls for improved health care services to support the fragile existing health infrastructure and services in Ogoni land. The need for proactive measures to improve the poor health conditions in Ogoni land and address the severe environmental damage caused by oil pollution, along with the limited investment in essential health services and infrastructure, is very urgent and timely. Following terms of reference to develop a comprehensive master plan, including the scope of medical services, specialized units, and the hospital's technical capabilities. We also asked to propose appropriate management and governance structures in accordance with extant rules and regulations, including recommending staff structures, recruitment strategies, and related human resource activities.
In addition, the committee recommended a clear governance structure to be headed by a management committee which would oversee the day-to-day administration and operations of the hospital. Earlier, Professor Barini Zabi disclosed that construction of the Ogoni Specialist Hospital has reached 78.2% completion, adding that the establishment of the technical committee was necessary to provide a clear and sustainable operational pathway for the facility.
Has advanced to 78.2% completion. It was therefore necessary to establish this committee to provide a clear and sustainable pathway for its operations. To this end, the committee's work is an essential phase in bringing the hospital into service. As we work to complete construction and thereafter commence operations,
He further stated that the Ogoni Specialist Hospital remains a key component of the multi-layered public health interventions being implemented by Hyprep across Ogoni land.
The Ogoni Specialist Hospital is a central component of the multi-layered public health interventions being implemented by Hyprep in Ogoni land.
Professor Zabi added that the specialist hospital represents Hyprep's efforts to address long-standing health services in line with the recommendations of the UNEP report on Ogoni land.
The Ogoni Specialist Hospital represents a strategic effort by Hyprep to address the long-standing health services gap in line with UNEP's recommendations for Ogoni land. The importance of the specialist hospital to the public health needs of the Ogoni people and the wider public cannot be overstated. When completed, it will operate as a referral hub, providing quality specialized care. while reducing the burden of accessing distant urban tertiary medical services.
The Hyprep boss conclusively stressed the importance of the specialist hospital to public health. Ogoni people and the wider public cannot be overstated. When completed, it will be operated like a referral hub, providing quality specialized care while reducing the burden of accessing distant urban tertiary medical services. From the Hyprep Project Coordination Office in Port Harcourt, I'm Ekikere Udom, reporting for Box TV News.